Our friends ask why we want to, it sounds it's really depressing to be an oncologist, but really it's kind of gratifying that we're able to treat patients through their times and I think improve their quality of life even though we might not be able to cure them. You could develop good bonds with the patients and also taking care of patients that are critically ill and trying to get them through the bad moments they were going through. The science of it too is pretty amazing. Even looking back, patients from a few years ago, we have so many more therapies, especially quality of life with all the new anti-nausea medicines. Most patients are not really that sick with nausea. I think lung cancer has really made a big difference over the last several years because usually chemotherapy was the main thing that we could use, but now with immune therapy and then targeted therapy, we usually do molecular studies on the material that we get the lung cancer and then to determine whether those patients need targeted therapy, which can be just pills instead of just IV medicines, and then immune therapy, which is the newer thing that's come out the last 2 or 3 years, is really, and patients can stay on that for several years without having to do chemotherapy or having hair loss and nausea. So it's really made a significant improvement. And I think we can, with immune therapy and the targeted therapy, we can help the body and the patient live with their cancer, kind of like treating it like a chronic disease like diabetes and hypertension. We might not be able to cure it, but at least let them coexist with the cancer and have a good quality of life. So I think with the new targets, there's going to be probably some new medicine that we can target a gene on a cancer to try to shut it off and not use the old chemotherapy agents that we've done in the past. Again, I think the relationships we build with the patients, the family, being able to sit down and talk to them and learn about their family and situations, those are all important things. And also treating the cancer too, but I think just the whole, getting to know, I think that's because sometimes it is hard to give bad news, but when we have really good news and able to help a lot of people, I think it makes it all worthwhile.